back to you with a COVID update show, but unfortunately the time has come. So as we have always done in the past, we want to thank UMA, Urban Media Arts, formerly known as MATV, for continuously working with us to bring you the latest in COVID-19 information. And we also want to thank our team here tonight, taking time out of their schedule. We have Chris Webb, our Director of the Health Department, along with the newest member of the Board of Health, Scune Carrington. So thank you both for being here. And then, of course, none of this happens without our Communications Director, Ron Cochran. So Ron, thank you as well. So the one thing that has not changed is we always like to have our guests provide an opening couple of minutes statement about who they are and how to contact them if there are any questions that aren't asked tonight that you would still like more information on it. And then the most important aspect of us coming together this evening is to hear from all of you. So we'll get to those questions right after these introductory statements. So let's start with you, Mr. Webb. You're on mute, Chris, I think.
Yes, I was.
It's been that long, Chris.
That was my statement. Been a little while since we've been together, but and that's a good thing. I don't think tonight's is anything to concern anybody. We're not coming on with any doom and gloom, but we have some good information to share. So if you, my name again is Chris Webb. I'm Director of Public Health for the city. And if you need to reach me, you can email me at cwebb@cityofmalden.org or call me at the office in 781-397-7049.
Very good. Okay, over to you, Scune.
Good afternoon, City of Malden. My name is Scune Carrington, and I am the newest member of the Board of Health, and happy to be here. And I am a clinical social worker by background. And if you do need to reach me, I can be reached at bohresponse@cityofmalden.org.
Very good. All right, let's get to it. The question that is on everyone's mind is, what exactly is the Delta variant? So Chris, we'll start with you and then go to Scune.
Well, it's the latest in the transformation of the original virus, and it seems to be the one that has had the most effect. You know, there are other variants before this, but the variant was so indifferent that only the Delta made it noticeable because it's so infectious and virulent as a virus once it's in your system. So it's nothing to be trifled with, and we're learning more and more every day. And I just want to say thank you for everybody that's gotten vaccinated, and anybody who can take a minute and think about it some more or wants more information, please use the information I've provided. Get in touch with us and we'll give you the best information available.
All right, Scune, is that about sum it up, or do you have further info on the Delta variant?
So we know that it's definitely twice as likely to be spread from one person to another from the other viruses that, from the other strains that were there before. And so very important for the people that had gotten vaccinated. And if you have not, to start to think about it, because this one is definitely very different.
Okay, and I know, Chris, a lot of people have asked, so where are we with vaccinations? We get the reports every week, but let's let the community know exactly how we're doing. What's the percentage of fully vaccinated Malden residents?
I can proudly say that as of today, we have a report that's not ready for publication, but I can share my percentage. We are at 67%. We are exactly even with the state average, which is good. It tells us a couple of things, is that statewide, it's the difficulties in reaching people who are not yet vaccinated are equal across the board. It's now our job to figure out what it is that we can provide these people as far as being information or access, for that matter, or language skills, whatever is needed. We have to figure that out so we can reach these populations, and that is what we're working on now.
Okay, and Scune, I saw you clapping at the announcement of 67%. So you think that's pretty good?
Absolutely. I mean, I'm very encouraged to hear that, and we are on par with what's happening with the state. So go City of Malden. That's very encouraging to hear how we're
Okay.
doing.
Scune, let's stay with you and then we'll go back to Chris. So on the new variants, is it your understanding that the vaccines are working? Even the Delta variant?
Absolutely. So from our understanding, so the vaccine can help with spreading the Delta variant even further. And most of the places around the country with low vaccination rates is where we have seen the spread further. So definitely it's working, and we need to just keep at it.
Okay, very good. Now, if the Delta variant wasn't enough, Mr. Webb told me about a variant I had to ask him to spell, which is Lambda. What is the Lambda variant?
It's one that they've had some of it in India, some of it in South America, and it's not as virulent, but it's still, if unvaccinated or not having a weakened immune system, all the things we saw in the first wave of the virus, that too can mutate and become a more dangerous one. That doesn't seem to have the same spread rate that we've had. So we're not seeing a whole lot of talk about it in the northern, continental area, Europe yet. Canada has not seen any either. I did check that. So it's a minimal, but it's there. And if it has the same time to grow and become another variant, it could become another germ of concern.
Yeah, someone asked Mr. Cochran and I, will there be more variants beyond Delta and Lambda going forward?
I think the Delta
involved, it's always going to evolve.
Yes, that's what it's doing all the time. As soon as it hits something that it's impeding its growth, it finds another way. And that's how a variant starts. Okay.
And Scune, so are there additional COVID-19 precautions for the new variants, or is it always as it's been, which is just to, take caution no matter what time frame we're in with this virus?
Right. So I believe the latest CDC recommendation is that everyone, including folks that are fully vaccinated, should wear a mask in public, indoor settings, to help with the spread of both the Delta and to also protect some of the other people that may not be vaccinated yet, like, children.
Okay, very good. Let me jump to Mr. Cochran. I know he's had some questions come in via Facebook, so let's shift to him for a second.
Sure. Thank you, Mr. Mayor. And just to remind folks at home, if you are watching on public access, there's a couple of ways that you can get your questions asked live, or answered live, I should say. And that is by dialing into studio, which is the phone number is 781-388-9394. Or you can hit us up on Facebook, send us a message there and communicate, your question there, and any ones that we don't get to this evening, we'll always make a point to get back to you with the follow-up answer. And then also one more thing I'd like to pass along, Christian Lamphere from Cambridge Health Alliance, who normally joins us for the show, was faced with an emergency at the hospital, so couldn't join us tonight, but he did want to pass that along, his regrets for not being able to make it tonight. Okay, with that said, I think the first question that we had, and I've heard about this one often, is of the folks that are ending up hospitalized with the Delta variant, is there a clear cut between who's been vaccinated and who hasn't in terms of how the virus plays out for those folks?
We want to start with Chris.
Yeah, let's go to Chris on this one first.
I got an answer for that. The actual numbers are 90% of people presenting in hospitals right now that end up in intensive care or on a ventilator have not been vaccinated. People who do have the Delta variant.
Chris, let me stop you. That is worth repeating. Say that one more time.
90% of the people presenting at the hospital with severe respiratory issues, who are going to be admitted to the ICU or put on a ventilator were not vaccinated. The other glaring things are that if you are vaccinated and you have that same experience, you have even if what we're calling a breakthrough infection, it is nowhere near what is going to be needed to hospitalize you. That's a fact. No one has been hospitalized with a breakthrough infection. They've been diagnosed and sent home. And of course, they're quarantining and doing all the things that they need to do. I had a close family friend whose whole family had breakthrough, and they equated it to a stuffy head, fever, cold. They took NyQuil, went to bed and rested and got their liquids. And in 3 days, they were back on their feet. So and maybe that's different for everybody, but that's generally what we're hearing.
Okay. Scune, do you want to add to that?
No, I think Chris summed it up really well. And I think from our understanding is most of the breakthrough infections for the people that are vaccinated that do get the Delta variant, they're very mild. And so it's showing us that essentially that the vaccines are working and they're preventing people from being hospitalized. So.
All right, Ron, at some point, Ron, will you host the flyer of the next, I think we have a vaccination push on the 31st, right?
Yeah, there's a couple of things we can discuss. I was going to try to promote not only the Vax Bus, and I'm not sure if the one that you're talking about, Mayor, is the National Night Out one. I don't know if that would be.
No, it was the first one, Ron, the Vax Bus.
Okay. Yep. So I'll make sure that gets shared. So while we're answering some other questions, I'll bring that up on my computer and share that. But the next question that I had, and I think folks
where did it
that
come
have,
in from? Facebook?
Yeah, so this was a Facebook question, and this is one that I see, on our streams, but this seems to be one that just kind of pops up everywhere in the news, and it's difficult because there a lot of folks just don't know what these terminology, what the terminology is, and in particular, you keep talking about breakthrough. What exactly is a breakthrough? And maybe you could explain its relationship to Delta.
Okay, Scune. Do you want to start with Scune and then we'll jump?
Yeah, why don't we go with Scune first, and then we'll go to Mr. Webb after.
I was going to defer to Chris in a second, actually.
Oh, okay, yeah.
All
right.
Yeah.
What's being described as breakthrough infections are people who've had at least one dose, but typically 2 doses. They don't know why it's only affecting more people with 2 doses than 1, but the reality is, even though it can be measured for infection, it's going to be a little different in each person, like I just said, and present itself differently in each person, but you are not going to be hospitalized with a breakthrough infection. You will have to quarantine. You will have to separate yourself from unvaccinated people, even vaccinated people, because you're still going to be shedding virus. So you don't want to put your next loved one in the same situation you're in.
Okay. And let me ask you and Scune, do you think, based on what's happening, that fully vaccinated residents will soon need a booster? Another shot beyond the 2 that they've received to be considered fully vaccinated? Scune, let's start with you. What's your hunch?
Yes.
Yeah, I was going to say same thing. Chris?
Yeah, I've always been the one that says no, but
Okay.
I have been hearing and reading a little bit, and the numbers are moving a little bit on that. I'm hopeful that they won't move so much in that direction, because not so much about the vaccination part itself. It's just who's ready to deal with that right now, and they better be sure that's exactly what's needed to, as well. And rather than put everybody or anybody for that matter through it, just get more people vaccinated. I understand that there are people out there that have religious reasons, and I totally respect that. But if there's any way that their religion would help them with the decision, I would be grateful for that consideration, because I just want everyone to make it through this thing. I don't want there to be a C or a D or an E. I'm sorry. I just can't imagine that in the world today, we can't get to the point where we start looking out for the next guy and really ending this thing. The only way to end it is with what the science tells us right now, and that's vaccination.
And Chris, if you had to guess, when do you think we might know whether our residents would need a booster shot? That would come down from the CDC?
It would. And right now the study is ongoing. So they're saying that it'll be fall before that decision could be made. And then, of course, they've got to get, it's going to be issued, they've got to go through the emergency approval process as well.
So you think if it all went according to plan, people wouldn't be getting their booster shot until winter, spring?
Probably more like October, November, maybe right at the flu season. I feel a new mixture of flu and COVID on the horizon, and I think it's a good practice. But I can't be sure that's how they plan on doing it.
Okay, very good. Back to you, Ron, in the studio. What do you have next from Facebook?
Okay, actually, before we get to the other question, I do want to go ahead and share my screen. Hopefully you all see that now, the Vax Plus flyer. First, just to Chris, this is the correct, I want to make sure this is the correct information I'm sharing.
It is.
Thank you.
Yeah, it's.
And for those that are maybe visually impaired, I can just describe what this says. And basically it says that our Trust the Facts mobile vaccination bus clinic is arriving soon. Climb aboard to get your COVID-19 vaccination. And the date is Saturday, July 31st, which is, wow, this Saturday. And it is from 12 p.m. to 6 p.m. at Malden Center. I'm assuming, does that mean Malden Center Station?
Yes.
Yes.
Okay. So do we know if it's Florence Street side or the rear?
Commercial Street side.
Commercial Street side. And one important thing that is also mentioned here, which, by the way, if you want to see this for yourself, it's mass.gov/vaxbus. But it also reminds us that residents who've been fully vaccinated can enter the Massachusetts Vax Millions giveaway. So if you're looking for a reason other than the one we hope that is the best reason, which is to stay, COVID free, here's another reason for you. And that is to enter to win potentially $1 million, which is not too shabby in my opinion.
Right.
Maybe a little bit later in the episode, we'll share about the other opportunity.
Let me just ask Chris and Scune, were you surprised that they're not offering Moderna?
No, I wasn't.
Okay.
No.
Okay.
It's probably just a manufacturing schedule.
Okay.
And the Pfizer is that'll cover everybody, kids included. So that's a good way to go.
Okay. All right. Ron, what do you have for a question next from Facebook?
Okay, this one is regarding actually we kind of just covered it there. The question was where can I get the vaccine these days? So maybe we can use this as a time to round up all the different places that someone may be able to get the vaccine, when and where. Why don't we go to Scune? Do you have these in front of you? You want to defer to Chris on this one, or?
I'll defer to Chris on this one, but you could also start with your doctor and your primary care doctor and get it there. And then in terms of other options, I'll defer to Chris to tell everyone in Malden where they could get it.
Okay.
That's a very good suggestion. And your primary care as well, and your pediatrician or your obstetrician, anybody that's available, your pharmacist as well. Don't forget, CVS and Walgreens are vaccination centers. There are 900 centers open throughout the state. So there are no lines. But a good experience, I think, for everybody, even if you don't get vaccinated, is going to be the National Night Out. And that's going to be, I had the date, August 3rd from 6 to 8 p.m. at McDonald's Stadium. This is always a really well-attended event, and most people are talking about it for days after. So please come. It's a good time for everybody. Bring the kids. There's going to be food, beverages, ice cream, giveaways, some contests, police and fire displays and demonstrations, and some community booths will be there. The health department will be there with a chance for you to be vaccinated as well. And after
All right.
that, we have the concert series. And I'm sorry, sir, but I don't seem to have that flyer in front of me.
I'll grab
Okay.
that while you guys
Thank
are for the next question. Sure thing.
Okay,
Yeah, so that
so school,
just about anywhere you can.
yeah, Ron, you're gonna pull up that flyer for the summer concert series?
Will do.
Okay.
I'm sorry.
Scune, what kind of precautions should a fully vaccinated person take, knowing the Delta variant is a threat?
Yeah, definitely the mask, and when you are indoors in an indoor setting or around non-vaccinated folks, especially for children that are under 16, definitely wearing masks around them. And I think all the other precaution, the washing hands and all that other stuff, but certainly the mask wearing, even though you are vaccinated, and certain indoor settings where you are in close proximity to non-vaccinated folks, definitely that's one of the big precautions that the CDC had just released.
Okay, very good. You know what, Chris, we may want to come out with something clarifying all these different suggestions. For example, I think it was in yesterday's paper now, they have a new category that if a county is transmitting, they're calling it one thing, and then one that is transmitting but not that badly is categorized a different way. Can you shed light on that now?
We hadn't had that shit talk to. That's another level. That's that epidemiological thing, because on our level, what they're talking about is the 20 communities and the work that's been done and the changes that you're seeing. And that if we're not the only 20, those 20 communities are not the only ones with high rates. We are historically diverse communities. It's not really only about our rate. There are other less diverse communities that have creeping numbers and have always had an up and down set of circumstances, and they don't know why. So that's where those two numbers are coming from. Is it a 20 where we have a diversity issue, or are we having a spiking issue? And then they're moving resources from one to the other.
Okay, speaking of which, can you tell the community what is the positivity rate as of today?
As of today, it is 1.9% per
And
100,000.
the threshold for you to stop being concerned?
Yeah, our number is 3%. I mean, in the first wave, we were always 4.5, but we're going to go 3%, and it may revise that depending on if we're getting double and triple case numbers in a week's time, that number is going to shrink. So that hasn't been the case. We've had 35 cases, and we're up front. We had 6 3 weeks ago. We had 21 the next week, and they had 35 this week. So I'm close on those numbers, but it's climbing. But it's not changing the rate because people are getting vaccinated. So as long as we keep vaccinating, the spread's going to start to creep down. Of course, we still are feeling some of the effect of people's vacation plans and 4th of July. So that's another factor we have to watch as well.
Scune, I think you mentioned this before, but what are the symptoms people should look for with these new variants? Are they the same as COVID-19, or are they different?
I believe they're the same with the fever, and it's just similar symptoms.
Okay.
Yeah.
Ron, did you have a question queued up?
Yes, but before I do that, it was requested to pop up the summer concerts flyer. So I'm going to do that right now. I'm going to share that. So again, a little cross promotion here, if you'll allow us that, but the Malden Summer Concert Series is going to begin on Tuesday, August 3rd. So it'll be Tuesday nights. They're calling it Tuesday Night Tunes at the new City Hall Plaza. And that's from 6 to 8 p.m. outside here at 215 Pleasant Street. And that'll be 4 dates, August 3rd, 10th, 17th, and 24th. And as Mr. Webb points out, at each one of those, you will have an opportunity to hear some music and get vaccinated at the same time. Now, a question for the panel: if there was a song that we had to play, would there be some kind of particular song that would be appropriate to maybe jazz up everyone to get them psyched up to get the vaccine? So I'll ask that now. We'll see. We'll take answers a little later in the show. So stew that one around a little bit. But no, the next question, and I think we're going to go to Scune on this one, is we are, of course, giving ourselves a round of applause for the 67%. But of course, my math is correct. We're still at a percentage that's not 100%. So that means there's a hesitation there, I'm assuming. And maybe you could go into maybe some of the hesitations that you've seen, as a clinician maybe, and some of the methods in which we're targeting or trying to get a hold of population who, is hesitant.
So I would say, at least from personal, just family members, I think it's just the wait and see game, because I think there are definitely some trusting issues. It's still safe. I mean, you'll still have folks that are still asking that. And so for those that are vaccinated, it's like, I took the vaccine and I'm okay. I didn't turn into a pumpkin. And and so it's good modeling, and just be like, okay, and people to go with them, because I think some people thought they had to use the internet and to register and all of that, and the accessibility is a lot more whitened at this point, and so you don't need to pre-register. And I think some people were just a little intimidated by all of that. So now it's readily available. You don't need to make an appointment anymore, and you don't need to go to Foxborough, and it's readily available down the street at Walgreens for most of the time, and there's no appointment. You could call your doctor, and some of the your local community health center is also there. So I think those barriers initially, when we had to get everyone vaccinated, intimidated folks a bit. And I think there were reservations too, with a lot of folks staying in line, and it's like, I don't want to be around that much people when I've been quarantined for a while. So now it's like, there's no appointment. You could walk through, you could just get it done. So I think there was just a little bit of wait and see, or let the crowd go. And there's now the chance to win $1 million. So like, there's another incentives for people.
Okay, Chris, do you want to add?
No, I think it's pretty much, we're excited about, we've had some interviews this week, and we've made a selection, but I can't say who yet. But I'm, happy that we've gotten to this point. We're going to have a great outreach program in the next coming days. It's going to be homegrown. It's going to be someone from the community who gets what we're trying to do, and that is reach those people who are most reluctant. And most people, exactly as Scune said, they're misinformed is number one. We know that. Number two, there may be a religious issue, and that's totally acceptable. But what we're hearing most is people don't trust the drug itself or the process, the RNA. What is it? So, and I heard that in a few conversations and interviews that I had in the last 2 weeks, and it really rung a bell that maybe that's what we need to do. And instead of saying what the benefit of the vaccine is, I think everybody knows that, but they want to have trust in what the RNA is. And we're going to try and do a very simple explanation of that and get it out to people and make it part of our messaging, so that people really know what it is. It's not new. It's just in this application, it's new. And people should understand, it will be the way vaccines are made in the future, because it's reliable. It doesn't rely on eggshells like you use for flu vaccine. It's efficient. And you can develop new vaccines faster.
Okay. Is a person's risk of breakthrough higher depending on which vaccine they received? Chris?
The science says no. There was some concern, and I actually saw it on the evening news tonight from a very reliable source, that no, they now know that the J&J is as effective as the other two for breakthrough.
Okay,
It was-
Scune, I saw you nodding. You agree, right? Nothing you know.
100%.
Yeah,
I agree with Chris. Yeah.
Let's stay with you and ask if you are tested for COVID-19 and the test comes back positive, can you find out whether or not it was caused by a particular variant? Have you ever heard of that?
Is that from someone that has been vaccinated or someone that's non-vaccinated or asymptomatic and
Oh,
then
right.
tested for
Question.
COVID?
Yeah, they didn't say in this question. So you'd have to know that, I guess, I presume?
Yeah, absolutely. Because if you already took the vaccine and then you got tested positive for COVID, there are just other protocols to that part. And then if you were symptomatic, it will follow the same one prior to that. Like
Right,
the same
Chris, makes
process
sense.
prior to getting vaccinated. Yeah.
Yeah.
They will test every positive now because the testing rate is so low. So yeah, they'll tell you whether you had Delta. That's how they're keeping track of how many cases there actually are of the Delta variant.
Okay. To both you, where can residents go to be tested today for COVID-19?
Cambridge
Yeah.
Health Care on Canal Street
Okay.
is a great location.
Scune, you were going to say primary
Yeah,
care?
primary care. And also you could just go
I'm
to your
listening.
local one. I have a pattern now. You could go to your local Walgreens, right? Drive through our CVS and you could stay in your car right through the drive through and just get tested there.
Okay.
And I believe they also have some over the counter testing as well. So that way, if you have to take a flight, you could just send that to the lab. So those are also available for people to just purchase. But it's free if you go to your Walgreens and your CVS, but you can also purchase them and test yourself at home and send it into the
Right.
lab.
This came in to Mr. Cocker and I from Facebook. Are vaccinations required for any of Malden's first responders, police, fire, and ambulance services? If not, which they're not, I presume, what are their respective vaccination rates that you know of? Chris, and then to Scune.
Well, I can only say that we didn't factor the vaccination rate on the police or fire simply because it doesn't matter. They're part of the bigger number. It didn't factor into how we serve the rest of the community as to what uniform they wear. So that's not a number I have. It's one we could get. I imagine it would take a little digging because they weren't treated like police or fire. They were treated as citizens. So they aren't delineated in the data that way.
Okay.
But
And it's not required, right?
it is not required. They're human beings. They have the right to make their own medical decisions until and unless the law changes. And I don't see that coming anytime soon.
Scone, you agree? You don't see the
100%.
law changing?
And I'm not sure. So I think it depends on which direction we head in the fall, but I think that's certainly an information that's important for us to have, that our public servants and that people that do serve the community at the government level, that they are following the guidelines. I think that's an information that's important for the public to have.
Agreed. Ambulance doesn't fall under us, but the last time in my weekly meetings with the police and fire departments, both chiefs, I think, thought that roughly 70-80% of the members in each of those departments have been fully vaccinated. Does that sound right, Chris? Yeah.
Yeah, very much so. Yeah. And, and some people understand there was reluctance there. And a lot of those officers came and firemen came to later clinics when they got their information and they felt, it was time.
Right. They also asked Ron and I whether or not masks will be required for kids in schools this fall. I have a child going into first grade and very concerned that they might not require masks. Also, will they be doing pool testing in schools? Chris?
Well, the pool testing is I think is something that we'll still do. Granted that the funding holds up because it can become very, very expensive, but we had the emergency funds. I don't know how all that works anymore. I'm sorry, Mr. Mayor, that's not, I leave that to you. But
Thanks.
more than welcome. And, I think that the Binex testing that we were doing and the group, ultimately the group was really informative in a lot of ways. And I think it taught parents where the concerns should be and how best to talk to their kids and make sure they're wearing their mask and using the hand sanitizer and, watching how they cough and, their distancing. And I know that our kids did really well. Our teachers were very impressed. I remember having many conversations with the superintendent about the rave reviews he's getting from the teachers about how good the kids are doing. Now, that's early on. I know it was difficult. Kids had to adapt to it, and it's socializing is an issue. Totally understand it. But if we go into the next school season and we have an infection rate that is unsafe, I think, yes, the kids will have to wear masks for their safety because they haven't been vaccinated and they can't be, especially the youngest of them, because by then the variant is going to be that much stronger and it's going to have been spread through that many more people. That's our concern. I'm not worried about the numbers. I'm worried about who's affected next. And right now, I never thought we'd be sitting here talking about the youngest among us when we started this conversation 2 years ago about the oldest among us. So the fact that we even have to have this conversation to this extent still kind of baffles a lot of public health officials.
All right,
Really?
Scune, what's your guess? You think masks will be required?
Absolutely, because I think you have like a high mix of kids that are vaccinated and some that are unvaccinated, and you still have the Delta variant, and you still have a number of kids under 12, and so I think many folks miss the in-person learning, and I think to just sort of promote that and support that, the CDC themselves are recommending for universal indoor masking for teachers, staff, students, and all that. So I think to return to in-person this fall and to really encourage it, because I think many people just missed it. Definitely the indoor masking, even if the kids are vaccinated. Because
Scune, you think it will be required of everyone in the schools to be masked up in the fall? Is your best guess right now?
My best guess right now, yeah.
Okay. I'm sorry, Ron, did you have something too? Looks like you had a question in the queue.
Yep, we can move on to the next question, and I think we're going to go back because we answered sort of the first half of the vaccine hesitancy question, and actually before I get to that, one interesting fact that I'd like to see if either one of our guests could comment on was if there, one of the common ones that we hear all the time is that, hey, we don't know what that new technology, the mRNA, what can it do? There's no long-term effects and there's no long-term studies about what it could do, which it can be really intimidating when you have an uncertain future. But then I heard an interesting statistic the other day, which was to say that no vaccine in history has ever presented any kind of negative effect past the 3-month mark after the vaccine. And I don't know if you guys can comment on that. I thought that was striking because if you think about just a simple calculation about what you are at more risk of. So right now we're over a year. Is it over a year now from the first vaccinations?
Yes.
So, on the order of hundreds of millions. And with that interesting statistic, if something on some order of magnitude was going to present itself, would you say that it would have presented itself by now?
Scune?
Absolutely. And you have like just a range of folks across race, across ethnicity, gender, and even, pregnant women. Like you've had everyone at this point, a mix of folks that have received this vaccine. And like you mentioned, Ron, within the 3-month mark, if we haven't seen something that has presented itself, it just shows you just how safe the vaccine is at this moment.
All right.
But
Chris,
they are
agree?
continuing to research it. And, yeah.
I think about back when they first made vaccines in the 1900s, okay? They were making vaccines back then. They knew they weren't safe, but they kept going at it, and kept going at it. They come across the influenza vaccine, and that's been improved over time. And with little or no measurable long-term effects for people. Now, some people get a Guillain-Barré, and but they're a minuscule amount, and it's horrible that it has to happen, but most people recover. Some don't. Very small, 0.5% maybe. So it's not a common thing based against the fact that we've been, how many hundreds of millions of people have we vaccinated here and around the world every year? Keep in mind, every year that goes on. It's not just during COVID. We vaccinate people in our clinics year round for any number of the childhood diseases, and measles, mumps, rubella, all the things nobody wants to get. So, the vaccination issue in scale and the long-term effect of what might be in the RNA, which is ultimately a cleaner vaccine and more efficient. I think you're going to see that 3-month period shrink in the end net result here. I don't think you're going to you're going to find that it's a much cleaner process and leaves little or no trace behind in the long run. Now, we know we have the cardiac issues, but is that vaccine or is it some part of the vaccine? We don't know yet. And that will hopefully be washed out.
Okay.
Sorry.
All right. From Stacy Gilchrist. My boys are in the summer programs at Linden and Forestdale, and the majority of the teachers and staff haven't worn masks inside all summer. With the new CDC recommendation that all K-12s mask indoors, even if vaccinated, will that apply to these summer programs held at the Malden schools? Or should it? Chris?
As of today, no. Our infection rate is not there yet. I know there is a lot of discussion with the new superintendent, and I had a brief conversation the other day. I think she's got a good grasp on it, and she and I agree that infection rate is the one trigger. And we're not, we're going to be working very closely with Desi on that number as it relates to Malden. We're not really worried about anywhere else. So we expect those conversations to start probably second week of August as we start to look down the barrel of the new school year. So, people will have, I think if we're going to know, we'll have enough notice and sometime to just discuss it and figure out the best ways to make it, work. We know a lot that we didn't know before as far as being able to let the kids socialize. Keep in mind, this would only be an indoor issue. They go outside, we know that the spread rate outside is much, much lower. So I think we'll be able to work some time without the mask as long as we can, put certain conditions in place.
All right, very good. Scone, you agree?
100% what Chris said.
All right, very good. Rob, what do you have in the queue over there?
The next question I have is in regard, and this is this was emailed to us. And the question is with respect to those that were previously infected with COVID and the relationship to or likelihood of breakthrough and or reinfection. Is it different than the vaccine, more or less? How does that work?
Chris?
I'll take that. Yeah, it's actually that this is new data out too. In the last few days, I heard this. I didn't read it. I heard it. It was actually higher. The breakthrough. I'm sorry. Give me your question so I can give you the correct.
Yeah, the question was with respect to those previously infected and recovered. What is their chances of getting breakthrough and, all the same questions about what the vaccine, but except if you had an infection?
There's the thing. They're saying that breakthrough is absolutely positively possible. It's like you weren't infected because if the amount of antibody you build is different in everybody, depending on your initial exposure. So a positive test doesn't tell you how many antibodies you have. So it's not a great way to protect yourself. unless you've had an antibody test and it's sky high. But you are more, and you're also more susceptible to the Delta, and you will get sick. So it doesn't protect you at all against the Delta.
Okay, that's interesting. That seems to be a common misconception that
It's two different viruses.
protection. Yeah, interesting. Okay. And I think what we were getting at before, we'll go back to Scune on this one, is for those that are still hesitant, and you mentioned, some various demographics. What's the latest concepts that people are for getting into some of these communities of hesitancy? Is there, outreach in foreign language? Is there outreach at churches? What is a way that we can get to folks that are still hesitant?
I say meeting them where they are, and wherever that may be, if that's at church, if it's knocking on the door. And I think also if it's people's right to question things, right? And it's great that people want to know a little bit more. We just want them to trust the science and not get, the wrong information. And so people could always call their doctor and find the right information, go to their local community health centers, and just being careful with where people are getting the research, because there's a lot of false information. So just want to make sure people trust the actual science around it rather than, other sources which may not be reliable. And so if people want to get the correct information, the best source is to reach out to your doctor. And if you don't have the doctor, I'm sure the Board of Health has like flyers with facts and information. Reach out to us so you could get the actual science, so you understand, so you could understand a little bit more. So that's great that people want to research, and there are some trust issues, and that's perfectly okay. But we want you to get the correct and accurate information. And I think some information are not. We have researchers that have been working on this for years, and someone that just posted something that may not have been entirely researched. We just want to make sure the science is what you're getting at. So if you need information, please reach out to the Board of Health. Please reach out to Chris. Like we have information that we provide to you. Reach out to your primary care provider, your local community health center, as you are doing your research to get the actual science during part of your research, and then to make an informed decision about getting your vaccine. And other languages, we may have them as well. And so, so please reach out to us. We are available and there if you have additional questions and stuff like that.
Okay, and actually, Chris, similar question. Or do we? What I think you had mentioned before about this new outreach role that is coming out of your department. What are some of their first assignments? What are some of the strategies we're going to take from City Hall to reach some of these hesitant communities?
She's first going to reach out to our community partners that we're working with now, which is the Greater Malden Asian American Community Association. They're doing great work. Of course, Neighbors Helping Neighbors, they're always very helpful. And all of our typical partners, Cambridge Healthcare Alliance, and we're going to go to, like Scune just said, where people are. We are getting more data every day that helps us narrow down where the people are that haven't been vaccinated, or at least those parts of the neighborhoods that have the most people that haven't been vaccinated. And we're going to get there, and we're going to, have this person and others like her reach out to people, talk to them, find out what the issue is, and then address whatever the concern is, if it's possible. Some people cannot and will not be vaccinated. I understand that. But I would ask that anybody else who's thinking about it or hasn't done it yet for whatever reason, lack of information or understanding, don't be afraid to ask. Come down to any of these events. The nurses will be there. They'd be glad to talk to you about it. Just because you ask them a question doesn't mean you have to get vaccinated. So, this is a good time to learn about it. And these are great environments to do it in. No one's going to make you do anything you don't want to do. But please get vaccinated.
Okay, the next question we have is we're talking about a booster, but let's go even further than that. For those of us that have no hesitancy and just want to make a COVID vaccine a regular part of our annual, routine, much like the flu vaccine, when do we schedule that? Is it 1 year from when you got the vaccine? Is it 6 months? What's the time in which you'd schedule that or put it on your calendar? Let's go to Chris on this one.
I would say flu season. When you get your flu shot, I think your body is really ready and open to good reception of vaccine. It knows that vaccine's coming if you get a regular flu shot. So, I think that's probably when you see it. It's when the health departments and the people that supply the flu vaccines can do it. And historically, it's had great results. So, wouldn't change it.
Okay. And I think that was it I think we're set with our COVID questions. We did kind of have an outside question that I thought might be right up Scune's alley here. And I think it absolutely ties in. And that is folks that are seeing, like Chris says, we're not here to bring you doom and gloom, which I appreciate that he said that. However, the concept of going back into things that once plagued us, spending time inside, working from home all the time, potentially remote school, all these things that are coming back to us, it spawns the idea of mental health and how important that is. And I think the topic is now skyrocketed in the media with the recent withdrawing of Simone Biles from the Olympics. I was hoping maybe you could tie that in and talk about what could we do to knowing that this might happen, right? Knowing that we might have to get more restrictions. What can we do now to help with future mental health challenges?
Thank you, Ron, for that question. And I think we have been physically distanced and also socially distanced. And I think I know even for me that it was really hard to just kind of get back out. I have been, doing the quarantine and all of that, but there are some smaller ways we could do that. So I live not too far from the bike path that runs right behind my house. And I think some people started to go for walks and just go out there you don't have to just go right into the routine. Like I don't, I love concerts, but I haven't, I'm planning to do some of the concert, just looking at what the variants will be. So I think it's just an assessment piece. So that way you could go back to being not physically distanced, but socially distancing yourself or get back to your social things. But I think for the mental health piece of it, for people that are experiencing just a little bit of depression and feeling back into the rut, I would say just reach out to your insurance providers. They do have behavioral health clinicians for you to just talk to someone, especially if you're experiencing any thoughts of harming yourself or feeling like, you're in a rut and it's like, usually I enjoy doing this and I'm not enjoying that anymore. So getting a sense of where you may be, or if you're withdrawing from things that you usually enjoy. And you don't necessarily have to be in a crisis to just talk to someone. Sometimes it may just be like, I'm not feeling like myself, or I'm discouraged by this, or just to talk to someone. And your insurance providers do have a lot of clinicians that are available for you to just reach out to a clinician to just talk. You don't necessarily need to be sick to just kind of discuss what it has been like to just kind of be part of a pandemic. And certainly if you experience anything tragic, loss from this, whether it's it's grieving or anything of that sort. So certainly recommending for people to just reach out to a mental health provider to just kind of process what it's like to just experience this once in a lifetime pandemic, living through that. I mean, it's been hard to just kind of being far away from family and a number of these sort of activities.
That was a great response. Thank you.
For sure. And Chris, Ron touched on it. What are the percentages that we will go back to those restrictions, if you had to guess right now based on what you know?
That's a great question. And I think a lot of it has to do with a few things that haven't yet happened, but probably will. Where Florida, Missouri, a little bit of Georgia, and Louisiana have exploded, people traveling in and out of those areas, it's got to be more restricted than it is now, or it's just going to keep going. As we say, that way it traveled north because basically the eastern states all adopted pretty much the same program and hoped up for the same results on their rollout. And for the most part, it was a phased thing. As you could, vaccine supplies arrived, and it's kind of what we expected. But in those other states, there was just such resistance, and it's horrible to say, but now they're paying the price. So what's the percentage it gets north like that? I'm going to say with the capabilities of the government and the health departments and the county government system, I'm going to say 10% that we get back to the day one. We don't have enough. We're on the opposite side. We're well over 50%. So no matter what, we're never going to be having the issues with our hospital. Our issues were surge at the hospitals, getting to people before they passed away. Those were the tragedies. I don't think we'll ever get there again, thankfully, because people have gotten vaccinated and the population, that number is upside down on the population. So I think we're at a point, and it's not a good point, that the hospitals could handle a surge. It would be nothing compared to the last one, but those workers would be at twice the time at risk, as well as police, fire, ambulance. And because of that, yeah, we might be driven indoors a little bit more. There may be more restrictions on dining. I don't think it will ever be like it was, though. Yeah, I don't see that.
Agree?
I agree. We are definitely surging in the right direction. And I think for the 27 or so % of people that haven't done that already, that haven't been vaccinated already, just want to continue to reiterate, get the facts and get the science, trust the science, and get vaccinated. And then for the kids, they are still doing some research, and hopefully we will have some vaccine available for the under 16 very, very soon, so that way they could be protected as well. Because I think sometimes people forget that a lot of these kids are not also vaccinated, and with the Delta variant, there are some concerns around that part. But we are trending in the right direction. Hence why I was clapping and very proud of Malden for us to get to 67%. Very, very proud of the city. And let's get the rest of the 20 or so folks, and whatever information you need to help you make the informed decision, please reach out to us.
All right, very good. Mr. Carrington, so do we want to wrap? Do you have anything left?
Yeah, one more thing. I just wanted to pop up the screen before we wrap up that to share kind of all three of the flyers that we talked about. And so what I'm sharing now, hopefully you can see my screen with the three flyers there. Is that yes?
Yep.
Okay. Yeah. Left to right, we have National Night Out, which is a great night. As Chris alluded to, outdoor activity, highly unlikely for spread. So there's a great way for you to get out, get some fresh air. That's at McDonald's Stadium, 6 p.m. to 8 p.m. That's Saturday, August 3rd. That's this Saturday. And Chris and company will be there vaccinating. The second is the Pittsfield to Provincetown Vax Bus. And that's rolling into Malden on Saturday, July 31st. And that's 12 to 6 p.m. at the Malden Center T Station. And then again, the last but not least would be our summer concert series. And that is August 3rd, 10th, 17th, and 24th. That will be 6 to 8 p.m. at City Hall Plaza. And once again, Chris and company will be there vaccinating. And of course, all three of those locations are eligible once you get that vaccine to then apply for mass.gov/vaxmillions. So come and get your $1 million as you get vaccinated. Like I said, if there's not a good enough reason, let that be the one. And with that, we'll go ahead and kick it off to you, Mayor Christenson, to wrap things up.
Yeah, just make sure, Mr. Cochran, that you qualify that million before taxes.
We do ask, yeah, that's right, qualify before taxes. And also, if you do win the million, please be sure to spend it on many restaurants in downtown Malden as possible.
Yeah. All right. Well, let's end by how we began, which is thanking both of our panelists as well as Urban Media Arts for helping us put tonight's show on. So what we typically do here, Scune, is allow our panelists to just make a few closing remarks, and once again, letting the city know how they can contact you in case they have further questions after tonight's show. So let's start with you, Scune.
I was very happy to just spend this evening with the city of Malden. So thank you for everybody that tuned in. And gonna reiterate again, if you haven't been vaccinated and need the information to make the decision, please reach out to us. And the best way to reach out to, if you want to reach the Board of Health, is bohresponse@cityofmalden.org. Looking forward to hearing from all of you.
All right. Thanks again. Mr. Webb.
Like I always say, I always enjoy doing these shows. I hate the lead up to it because I always get nervous, but I appreciate that people do tune in, and I appreciate that there's conversation and take away what we've spoken about tonight and share it with people, and get back to us with what you think. And the best way to reach me is cwebb, WEBB, @cityofmalden.org, or call my office at 781-397-7049.
All right. Very good. And anything final from you, Mr. Cochran?
All set on this end, and we'd like to thank everyone for joining us. And we will, once we reconvene this, let's hope, Terlanzo over at UMA reminded me that this is show number 29, and I had such mixed emotions about that, because it's great how many times we've been in front of the community to give this valuable information. But the more of these shows we stack up, it seems to be is a sign that we're not, all the way where we want to be. But nonetheless, we do want to thank, UMA and company for helping us get that word out. And when we reconvene the show, we will post to our social media channels to let everyone know when our next show is.
All right. Very good. So on behalf of UMA, our panelists, our communications director, I'm Gary Christenson, Mayor of the City of Malden. Always remember, this is a marathon, not a sprint. So let's continue to work together to keep our city moving forward. Good evening, everyone.